Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. Now, we're going to discuss Jason Leech. He has been branded a loose cannon. He has many jobs, a whole raft of different jobs, but none of them seem to be exactly what they are. Nobody's sure exactly who he works for. Some of the jobs are within government, some of them are without. He is under certain rules for freedom of information because of his government roles, and yet he's not under those rules for his other jobs, even though those other jobs may relate upon things he's doing within his government role. It's all very shady. He's paid a very grand wage, and yet he is not in any way qualified to do the things he's doing. For example, he calls himself a professor, but he's not actually a professor. He says he's a doctor, but only of dentistry, and he's failed that 7 times. He's not anyone who should be dealing with epidemiology or infectious diseases. He's nothing to do like that. And we've mentioned these in videos past. But we're raising this because of the concerns of his role, his qualifications, his experience, and the fact that nobody really knows how to pin him down into whatever job he's trying to do. So how is his accountability being marked, shall we say, within his role within government? He's employed by the NHS, but he's on a permanent secondment to the government. Now, if I'm going to say if you're on a permanent secondment, then really you're employed by the government. You should be completely under the rules of freedom of information and record keeping and things like that. But because of the shadiness that the SNP have over this issue, that really isn't the case. And that's sort of the background of where he is. Now, Rab Wilson from Action for a Safe and Accountable People, NHS, ASAP NHS, for which Roger Livermore also works, and more of him in a moment, says that Jason Leech appears to be entirely a law unto himself. And no other employer or organisation would allow an employee to act in such a way as Jason Leech is being allowed to act. And I think Rab Wilson is completely correct. And this sort of spreading of role and spreading of responsibility is dangerous. And what's worse, though, is unaccountable, unrecorded, and that things he does and says aren't subjected to the same control as anyone else within government would face. It's absolutely awful. Then, of course, you take into consideration the fact that he deleted everything as he went along on his phone, and the fact that he had over this 5 different phones goes to show how shady Leech is, because nobody has 5 different phones unless, generally speaking, they're involved in some pretty major shady crimes. But that's not what we're going to look at here. Well, that's just the background, because what we are going to look at is an email sent by dear friend of the channel, Roger Livermore, to Humza Yousaf and others with regards to many different subjects, but Jason Leech is mentioned within them. But it is just a thing that you must know about Jason, which we've now covered. But we will get into this email and hopefully it will further expand upon the sort of things that are going on. Now, this email was just a week ago. I did mention about a week ago that this was coming, and now we've got it here. So we're going to go through this email that Roger has sent to Humza, in which he is, amongst other things, mentioning Leech. Here goes. So within this, I have just removed sort of Roger's email address, and that, I don't care if you see mine. The email address you'll see there is the one I got on my website. Oh, sorry, on my channel. So if you see that, it doesn't really matter. It's out there. Don't care. But I've obviously for security, I've removed Roger's, and that's there. But this is an email. So this is him sending to me what he's got. But here's the email that Roger has sent to our dear First Minister, as he puts it. Absence of law. He says, as you are well aware, the principal legislation on the prevention and control of dangerous pathogens, such as the SARS-CoV-2 and the pandemic in the UK-wide legislation, COSH, PPE regs, HSWA 1974, MHSWR and RIDDOR, They also apply to the thousands of healthcare acquired infections and in related social care and care homes, the community healthcare acquired infections. In typical year, they would account for about 500 reasonably preventable premature deaths, which are known as RPPDs. According to ASAP NHS records going back to 2012, the SNP government has failed and refused to implement and comply with UK-wide law. So what he's mentioning, all those acts, COSH, PPE regs, things like that, they're all law. And they aren't England and Wales law, they aren't Scotland-specific law. Because of the nature of what the Health and Safety Act is, it is UK-wide law. This is law made at Westminster that overrides Scottish law. It is primacy. Scotland must obey these laws. They predate a lot of the laws that came in subsequent, but they have not been repealed. They are UK-wide. They must be agreed to. And if they're not agreeing to it, then they are in breach of the law. From 2007, as CS Health Nicholas Sturgeon, with the lead on patient safety, Mr. Jason Leech, failed and then refused to comply with their own statutory responsibilities under HSWA. The consequences for Scotland would be that about 2,000 RPPDs for each of the last 17 years. That's about 1,500 a year more than the standard background rate. Said responsibility for the delivery of healthcare and social care delivery is devolved, but the legislation to ensure safety is reserved. CS Health then, as SFM Sturgeon and Leech, ignored the law. Part 2. Absence of HSE pandemic regulator. As you know, the regulator of HSWA for healthcare, social care, including care homes, and of government, is the GB-wide HSE. Your Care Inspectorate does not override, he's just put, it's a misspelling, override HSWA, COSH, PP regs, etc. HSE is on the records as intentionally not complying with its statutory duties to uphold and regulatory compliance in these sectors. Sections 1, 3, 7 and 18 of the HSWA. It says, on the pandemic, it failed in Section 11 duties to inform and advise Scottish Government and its direct ministerial report, NHS Scotland, on the legislation and how to comply with it. As a revised Freedom of Information request for the period of the 1st of January 2020 to the 31st of December 2020, please provide the record of meetings, minutes and correspondence with HSE on the SARS-CoV-2 and of the safety of patients, care homes and social care. And because of HSE's noted inactivity in the pandemic, there may not actually be much. See the joint Westminster DWP Health and Social Care Committee investigations. He says, please provide this information by close of play on the 1st of April 2024. Note, this information is critical to both the UK COVID-19 inquiry and the Scottish inquiry in the event that it is not cancelled. ASAP NHS has the evidence that HSE has not been discharging its statutory duties on infection control and pandemic prevention or on safety, patient safety generally, since at least March 2020. Like the Scottish Government, HSE policy is to not comply with the law. The consequences are a rolling disaster. A major consequence of the absence of law and regulation is that there was not legally required ensuring of pandemic preparedness, the measures prevention and control of infections. COSH has never been implemented or regulated in Scotland. Scotland has no facilities for handling a patient with a hazard group 4 or 3 dangerous pathogen such as SARS-CoV-2. The nearest facilities were in Newcastle. Your unqualified, deep breath now, your unqualified and extremely dangerous National Clinical Director Mr. Jason Leech was even on the BBC Scotland, bizarrely and grossly irresponsibly stating that the law did not apply to patient safety. This was in the wake of the 40 suspicious deaths at NHS Ayrshire and Arran. The policy of ignoring the law by CS Health and DFM Sturgeon and the faux NCD Leech created Scotland's National Infection Prevention and Control Manual, known as NIPCOM. This did not comply with COSH, PPE regs, HSWA, MHSWR or RIDOR. It ignored hazard group 3 and 4 dangerous pathogens. Following NIPCOM, it would spread the virus rather than control it. It would create death traps for healthcare workers, care workers, other workers, patients, care home residents, and so on, all the public. ASAP NHS has repeatedly reminded the Scottish Government from 2012. CS Health, this is the Minister of Health, Sturgeon, Robertson, Freeman, Salmond, Scottish First Minister Salmond, Sturgeon, Swinney, and Justice. All senior management in NHS Scotland and HSE. So everybody who's important has all been notified. We repeated the warning again on the 29th of February 2020. 10 days later, on the 10th of March 2020, the Scottish Government adopted NIPCOM as its homicidal policy on COVID-19 SARS-CoV-2. The fundamental determinant of the spread of SARS-CoV-2 pandemic was the policy on infection control. This was set by the UK and the anonymous and secretive Four Nations IPC, the Infection Prevention and Control Cell. Unlike other COVID-19 groups, the membership was not disclosed, nor their qualifications and competence for the fatal role. There were no minutes produced. The UK public inquiry hearings only briefly mentioned IPC cell, for example CMO Chris Whitty, but seemingly had no visibility in the inquiry. The Scottish inquiry is years behind on this essential matter dealing with infection control now, let alone the next pandemic. We understand that IPC cell membership was from a Public Health Scotland, England, Wales and Northern Ireland. We are seeking confirmation, but we understand that the first two were Scottish, hence the adoption of Scotland's homicidal NIPCM. In the period 1995 to 2000, I co-devised with Dr. Richard Daniels and applied the statutory method of inspecting safety management systems of any organisation, Management of Health and Safety at Work Regulations, Health and Safety Arrangements 1992-1999. And as the lead inspector of Rail Track Network Rail, I applied this to GB Railways. The sector solved safety and produced the safest railway in Europe. In the NHS, I led team inspections, and as part of this lead topic was infection control, probably the biggest risk covered by HSWA and the HSE. NHS hospitals are inspected infection control manuals for compliance with COSH, with PPE regs, etc. I would have failed Scotland's NIPCOM and issued a statutory enforcement notice requiring its urgent replacement for a hazard group 3 or 4 dangerous pathogen would present an immediate risk to life. All UK adoption of Scotland's NIPCOM was extremely dangerous and unlawful. HSWA offences and convictions require no causal link to actual harm. But in this case, it should be guaranteed to link NIPCOM to the spread of the virus and many thousands of deaths across the UK. The HSE is highly culpable. HSE's failure to discharge its statutory duties in Scotland on infection control and the safety of patients and care home residents led to many thousands of deaths across the UK. In 2012 and again in 2019, HSE signed an unlawful agreement were the SNP government that left patient safety in Scotland, including infection control, without the legally required regulation. Absence of defence. HSWA is a special and highly effective and proportionate form of legislation for offences under HSWA and COSH, etc. Any defence by duty holders must satisfy Section 40 of HSWA. Section 40, onus of providing limits on what is practical, etc. And he's going to quote Section 40 here. In any proceedings for an offence under any of the relevant statutory provisions consisting of a failure to comply with a duty or requirement to do something so far as is practicable or so far as is reasonably practical, or to use the best practicable means to do something, it shall be for the accused to prove, as the case may be, that it was not practicable or not reasonably practicable to do more than what was in fact done to satisfy the duty of the requirement, or that there was no better practicable means than that was in fact used to satisfy the duty or requirement. In other words, it's not up to the government or not up to the prosecutor to prove you broke it. It's up to you, the defendant, to prove you didn't. And that's a very strong law. It's one of those very few where you are guilty and have to prove your innocence. Those involved from the Scottish Government, its unqualified National Clinical Director, Mr. Jason Leech, its direct report NHS Scotland, Public Health Scotland, and the Four Nations IPC cell cannot satisfy Section 40. Therefore, they are breaking the law. They're all broken the law. Yours sincerely, Roger M. Livermore, and it's signed off by or to Prime Minister Rishi Sunak, Baroness Hallett, Lord Brailsford, Keir Starmer, Ed Davey, Douglas Ross, Anna Sarwar, and Alex Cole Hamilton. And that, ladies and gentlemen, is Roger's latest email with regarding this. Basically, everyone in government, everyone that the government controls in terms of health and safety, all breaking the law. They've got people running it in the form of Jason Leech, who is not only not qualified, but is dangerously not qualified. He is not anyone that should be dealing with infection control because of those lack of qualifications. And so the person who has appointed him is also not taking Section 40 into account of taking practicable steps by, appointing people who are aware of what they're doing. There is so much illegality. Let's hope something comes of it, but I'm not going to hold my breath. Now, I'm not going to come up. I am just going to end here, but I hope that has been somewhat illuminating. But certainly Leech should never be in that role. Anyway, thank you very much for watching it. It's gone on a bit longer than I intended, but that's how it is. It was a long email. Thank you, and goodbye.